Hello. Okay, so I'm going to do my physical assessment video. Before I go into the patient's room, I would wash my hands, check the patient's chart for allergies and their cold status. Okay, so now I'm about to enter the room. Knock, knock.
Hello.
Hi, how are you?
I'm wonderful. How about you?
Sorry, can you see? Okay, my name is.
You want to go back there?
Do I want to? I'm going to do my hand hygiene and put on gloves. And now I'm going to assess her head and look and make sure there's no lacerations. Make sure it is, check the hair and check the strands, make sure she's not shedding or anything. There's nothing abnormal here. Touching the skull, making sure everything is good there. And then I'm going to look at the face. I'm going to make sure it's symmetrical, and it looks like it's symmetrical. Also, I'm going to check the nose and make sure it is aligned right and everything. And to check and make sure her nose is patent, I'm going to have you cover one nostril, close your mouth and blow, and breathe. Okay, other one. Okay, patent. Now I'm going to have my pen light. Look at her nose and make sure everything is clear, moist and pink, everything as well. So now I'm going to check the lips, and I'm going to check the lips and make sure that they're pink. Make sure the lips are pink and everything. So I'm going to check the lips, and I'm going to check her oral cavity and her teeth to make sure that she, see what's going on. Open her mouth and say ah. Yeah, and check her teeth and everything. Make sure you see if she have any cavities or any fillings or anything. Her mucosa was pink and moist. Nothing abnormal about that. Okay, so after I check her lips, I am also going to check her ears and look and make sure you see if there's any buildup of anything in there. All that, look. In there, everything looks good. They're symmetrical. Okay, also, I have to assess her neural status. Can you tell me the date and where you are?
I am at Federal Tech Hospital, and what you asked for the date?
Date of birth.
Okay, the date of the. Okay, I was born August 1st, 1987, and today is September the 21st, 2019.
Okay. What time it is?
It is 7:35 p.m.
Okay. So now I assessed her neural level of consciousness, and her speech and everything. Now I am going to, so after I have assessed her level of consciousness, I see her appearance and her being well groomed. Everything is nice and well groomed. Her skin looks well. She's dressed nice, no dirty fingernails, nothing like that. Everything is good. No sign of struggling or nothing like that, or being, misfortunate. So now that I've checked her appearance, I'm going to have you raise your eyebrows and close your eyes tight. Smile. Okay. Checking all those functions, make sure they're normal. Now, I'm going to check her eyes. Take my pen light. Do each eye. Make sure that it can stretch with the light. Okay, it does. Look past the object, and then like that. Okay, as well. And follow. Okay, good. Okay, eyes are pearl. I'm going to look at her thorax as she's breathing, make sure that it's even. As she is breathing in and out, the thorax is even and symmetrical. So now I'm going to listen to her lungs. Okay, ma'am, can you lift up your breast for me, please? Okay. Then I'm going to have you turn here. other side. Okay, now I'm going to do the back. Lungs are clear to auscultation, so now what I'm going to do is going to palpate her front part and make sure there's no masses or, you know, no abnormalities, and I don't feel anything. Check her carotid pulses. Just turn slightly to the left for me. Okay. Her pulses are present. They are not thready. They're strong. So her carotid pulses are good. Now I'm going to check equally her radial pulses. So now, yeah, do it every time. So check. Yeah, okay. The pulses are equal on both sides, and they're pulsating at the same time. I'm about to listen to her heart sounds because I forgot to do them when I was doing the lungs, but I'm about to do them now. Emily, can you give rest for me, please? The apical pulse. Normal S1, S2. Now I'm going to check for peripheral perfusion of, you know, check the skin and make sure there's equal blanching, because skin turgor, and make sure there's no edema on the feet and everything. A little swelling. Okay, so now after that I'm going to do
Plus stupidity.
right. I'm going to do the pedal pulses now after this. And now, so now I'm going to do the pedal pulses, and I'm going to feel for them equally. They're present and they're equal and they're strong. Into the popliteal pulses.
You want me to stand up?
Yeah, you can stand up. So listen to the popliteal pulses, I did the pedal pulses, and I did the radial pulses. Let's check the bowel sounds, and I want to palpate, make sure it's not hard, it's soft, not distended or anything. Any pain? No pain? I'm listening to the bowel sounds. Bowel sounds present in all 4 quadrants. Now, you know, just make sure there's no distension, no bladder distension. There isn't any. Now, what I would do normally is I would check the genitalia when I would, you know, check the vaginal area for secretions, redness, or any kind of abnormalities, as well as in the anus as well. Make sure there's not any maybe hemorrhoids or any kind of discharge or abnormalities in the anus area or in the gluteal area as well. Now what I'm going to do, I'm going to check the limb movement and to make sure there are no deformities. I'm going to check the hands and the arms. Hold your arms out for me. Make sure there are no deformities or anything like that. Also, could you bend over, touch your toes, and make sure there's no spinal curves. Okay. Seems symmetrical. There's no spinal abnormalities. So now I'm going to ask her, I'm going to check for the strength of the muscles. Can you turn your head left and right for me? Okay, can you shrug your shoulders up and down? Okay. Take your arms, go all the way up, okay, down. Okay, I want you to squeeze my hands at the same time, okay, equal strength. So you squeeze, okay, push up, down, okay. Now we're going to do the feet. So have a seat.
You want me to turn the chair?
Fine. So now I'm gonna have her, I want you to press your foot down like a gas pedal against my feet, against my hand. Okay, come up. Okay, good. So now what you can do is, you're gonna hold your arms out, and rotate. And twirl your fingers and all that. Okay, now lift it up and down like this. Okay, so now can you walk for me? And while she do that, I'm also assessing her gait as well. Just come on back. Okay, perfect. Now I'm gonna have her use your leg like this. Okay, next one, other one, same way. Okay, and this completes my assessment. So what I would do now, I would put the patient in a comfortable position, put the bed in the lowest position, in a comfortable position, excuse me. I'm gonna give them a call bell, make sure they don't need anything. I will also perform hand hygiene, and I would take off my gloves, perform hand hygiene, and then document my assessment findings, and that'll complete my assessment.